We're pleased to have everyone here. And what we're going to do today is going to be very interesting. We have some panelists here who are going to discuss some very important things. And our first person that we have here, we have a number of folks. Chanda Johnson. Chanda is Jesse Brown Public Affairs Officer, and she's going to moderate these very brilliant people we have here today. Chanda is a U.S. Army vet with over 18 years of combined VA experience from both sides of the VA. As a patient and also as a staff member, she is very passionate about assisting her fellow veterans to reveal resources offered by the VA. Chanda, how are you?
I am fine, Mr. Kelly.
I'm so happy to have you here. And we have two folks that you are going to be talking to. And the discussion is Telemedicine My Healthe Vet. My Healthe Vet, right?
Correct.
Correct.
Two topics. So telemedicine and then My Healthe Vet. So we have Ms. Tambrey Seals from Telemedicine or Telehealth. She's a telehealth clinical technician with over 12 years of experience. And we also have Mr. Levi Laroco. Actually, me and Levi worked together as My Healthe Vet Coordinators when I was working at Hines VA. So Levi has been there with the program since it originated in 2004. So he has over 15 years of experience. And Levi, I think you're a nurse, correct?
Yes. Yeah, thanks.
So that's sort of unique to Jesse Brown because a lot of people in that role of My Healthe Vet are not clinical. And so Levi has one up on some of the other coordinators.
Okay. Continue with us. Where are we going with this?
I'm going to start off with Levi. Levi, if
Okay.
you can tell us a little bit about the My Healthe Vet program.
Sure. Thank you, Chanda. The My Healthe Vet program is a web portal that's been around for over 15 years now. It's a national program that allows veterans to access their medical information. And besides accessing that medical information, they are able to refill their prescriptions online, see their VA appointments, VA lab results, and they're able to download their medical records and also see VA, their x-rays and their radiology reports and images now. So it's a very useful tool for veterans that it helps them communicate with their providers through secure messaging, and also it allows them to obtain their medical information from the convenience of their home. They can access it through their tablets, their phones. They can access it through their laptops, anywhere they have internet access, anywhere in the world, actually, and they can gain access to that medical information. So it's very, very, very useful for them. It makes it a lot easier for them to, again, communicate with their provider as well.
That's great. This is internet access you can get anywhere.
Pretty
right?
much, yeah. It's pretty much just like banking, when we, if you belong to a big banking institution like Chase or Bank of America, for example, you're able to access your bank account anywhere as long as you have internet access. So this is the same format, pretty much. But it's very useful because if a veteran is out of state or out of the country, for example, and something happens to them and they need their medical information, they are able to access that as long as they have internet access.
How long has this been accessible to the vets?
Well, the My Healthe Vet has started 15 years ago, but it evolved over time. So, meaning each of the features that I just mentioned evolved over time. It wasn't released all at once. So every couple of years, a feature would be released. So, for example, pharmacy was released for them to refill their prescriptions or their medications, and then the next year they would release their appointments. They're able to see those. So, again, it's an evolving program. So it's it's and it's still evolving. There's still a lot of information that's going to be released for the veteran.
So, Levi, how would you sign up for My Healthe Vet?
Signing up is pretty easy, actually. So a veteran or a user who wants to use My Healthe Vet would be able to do it online. Again, if they have internet access, they can do it online through www.myhealth.va.gov. They register online, and then that's the step one. They create their own account. They create their own user ID and password. And then the step two process currently is they come to a VA, their local VA, and what we call an authentication. They have to go in-person authentication where they actually have to sign a form. And then we release all the features. Once they sign the form, we release all those features that I just mentioned to them electronically. So we want to make sure it's a security measure.
Sure.
So we want to make sure that we're releasing the information to the correct veteran. So we ask for their ID, and they sign a release of information form for the VA to keep on record.
That's great. How much has this been going well? I presume it has.
It's going well. For
Yeah.
example, at Jesse Brown VA, we service around 55,000 veterans in our outpatient clinics. We have over 55% of those veterans already registered and authenticated, and are actively using this format.
I think that's a great thing. That's helping a whole lot of vets, that's for sure. Where else do we need to go with this?
We're gonna switch. We're gonna switch gears,
To
and
Tambrey?
I want to Tambrey. And actually, we were talking about this earlier. Telehealth actually encompasses My Healthe Vet, so it's it's like the umbrella. So Tambrey's gonna talk a little bit about the different aspects of telehealth and everything that falls under it. It's a lot. It's mind blowing, but Tambrey.
Great.
So I'm Tambrey. I am the lead telehealth clinical technician at Jesse Brown. So telehealth, we have 3 different modalities. There is clinical video telehealth. That's when the patient can come to one of our outpatient clinics, like we have one in Crown Point, and then they would do a live video call with the providers at Jesse Brown, the specialty providers at Jesse Brown. So right now we have like cardiology, endocrinology, and we have a number of them. But the benefit of these appointments is that the patient can get a full exam. We have an RN on staff with the veteran at the appointment, and then there's a stethoscope, and the provider can still hear their heart and lung sound. So it's the same quality of care they would receive if they went to Jesse Brown, only they don't actually have to go all the way to Jesse Brown, which is a real chore for some of our veterans.
Sure.
Yeah.
Some folks out in some of the outer parts of Cook County, for instance, and so forth.
In Indiana.
Yeah, that's right. You sure? Mm-hmm.
Yep. So they can go there for some appointments. So that's clinical video telehealth. We also have store and forward telehealth, and that is when a TCC like myself, we will take images. We do dermatology, we do teleretinal, and we have telespirometry. Right now, we're gonna start reading sleep studies actually for Las Vegas, I believe next month. So how it works is we have the images for like dermatology and teleretinal. We have the images, and we upload them to the patient's chart, and the provider, the dermatologist or the eye doctor, will read them and diagnose the veteran without having the veteran actually come in to Jesse Brown. So that's store and forward telehealth.
Wow.
Now, are these appointments at their home? Are they going to a facility? How are they?
At any of we have our store and forward telehealth services at all of the CBOCs. All of our TCTs.
And what is
that.
CBOC? What does that stand for?
Oh, I'm sorry. CBOCs is the acronym for our outpatient clinics.
Mm-hmm.
Yep. So we have that, and then there is VA Video Connect, which is actually my specialty. I am the VVC lead. VVC is the acronym for VA Video Connect. So that's when the veteran can use their smartphone, computer, or tablet at home or wherever they are to have like a video call. It's like a secure version of FaceTime or Skype, and they can talk to their doctors that way. Our primary care staff at Jesse Brown is currently #1 in the country for VVC usage. I think like we're at like 99.4% of our primary care staff are using VA Video Connect, and the veterans love it because it's a good thing. Like if you had work, but you really need to see your doctor on your lunch break, you're in your car and you're on your phone talking to your doctor right there. And for veterans who don't have like the Wi-Fi or the webcam or a smartphone, the VA can actually order an iPad for the veteran. And the iPad can come with optional accessories, including a stethoscope, blood pressure cuff, scale. So the provider can get a full set of vital signs for the veteran in the comfort of their own home.
That's excellent. That makes a big difference. I think that how many people do we know this, and maybe I should be asking you this, Chandra, how many of the vets are really taking advantage of these modern things?
That would be a Tambrey question. Like,
Yeah,
how many
sure.
are you servicing?
Right.
So our supervisor, our facility telehealth coordinator, Martin Munoz, he just won an award because I don't have the exact number. I think you just posted on Facebook. Last year, we saw, she's going to get the number for
I
us.
think it was
But-
8,200, but let me make sure I'm right on that.
But he won a leadership award for how well our telehealth program is doing. Since we started in 2012, it was like we had like one clinic, and now we have hundreds when you include
Great.
all of the VA Video Connect clinics. So last year it was over 8,000 veterans used the telehealth modality.
Wow.
Yeah,
in 12 different specialties.
Yeah,
yeah. So we're
that's
doing.
paying off big time. Yeah. So where do we go from here with that? I should mention this to our call-in number, 312-374-8130, 312-374-8130. I've been caught up with all this great information. I didn't.
Well, one question I did have. for
Yeah,
you.
sure, go
So
ahead.
if someone wanted to sign up, how would they say, hey, I want to do VA Video Connect? What do they say? And who do they tell?
All they do is tell the provider. So right now, like I said, all of the primary care providers are using it. So all the patient has to do is let their primary care know, and they can arrange that with them. If they want to use clinical video telehealth, then the provider will put in a consult for them, and then our scheduler will contact them for scheduling. And I also do one-on-one appointments. I know sometimes veterans have a hard time with technology, and it's not just the older veterans, sometimes younger ones. So I will meet with them if they need to and help them through that. But our older veterans are doing really well with it, actually.
Good. Levi is acknowledging that by a head shake affirmatively. I just want to say, if there's anything you need to add, please feel free to do so.
No, I think there's a lot of myth out there that our older veterans don't use the technology, and they actually do.
That's good.
Because they are older and most of them are retired. They stay home and all they do is actually use technology, whereas our younger veterans are actually out working. So they're even though they know how to use the technology, they may not be using it as much versus our older ones. So
That's great to hear. Yeah, everybody.
But please know that there
Yeah.
is help available. I know, Levy, if you can tell them where your office is. I know with My Healthe Vet, even when I was at Hines, we will always take the time to not only sign people up, but give them a tutorial and show them where all of the hot spots were. Like if they wanted to look at appointments or whatever feature they wanted on My Healthe Vet, we will take time to walk them through the site.
Great.
But if, Levy, you can tell them where you're located at Jesse Brown, if someone does need help in your office hours.
yeah, I'm located actually right on the first floor of our building, so it's easy for them to. It's in room 1407. And it's easy for them to locate. I also have volunteers that are working in the primary care waiting room areas, ready to do the education and also guide veterans to getting started with My Healthe Vet. So we have a lot of resources that are available in the hospital to help them get started with it.
I think that's great. You know, I think, and I hope nobody gets upset about this, but Jesse Brown is just a great, a great organization. You know, obviously we have a lot of people that come in from Jesse Brown. We have a lot of folks that I talk to on the street, or, you know, not on the program, obviously, but they just come up with experiences. That's what I'm talking about, you know, experiences that people have. And, of course, I've been there, you know, and it's just a great job you folks do. Chandra, what else?
Levi, do you have like success stories like with My Healthe Vet? I know I had a couple, but I think you probably should have some too.
Oh yeah. Again, because of the access, you know, we have a lot of veterans that download their medical records. If they have for example, they have a claim that they're trying to do with the regional office for their benefits. They want to get more benefits, and sometimes they need a lot. They need documentation, medical documentation. They are able to do that through My Healthe Vet with ease, actually. So, yeah.
Well, I think that's great. Levi, Tambrey, you have anything to say?
We did have a success story. One time there was a veteran who needed to get to Madison VA for a heart transplant, and his family was not able to get him there. So Telehealth was able to accommodate the last minute request. We got him seen, and the next week he had his heart.
That is really a great story.
So we are saving veterans travel and time.
My goodness, yeah, that is great. Chandra, close us out.
Well, thank you so much for joining us. We would love to see you at Jesse Brown. We would love to see you at Jesse Brown. Our doors are always open. If you're interested in My Healthe Vet or Telehealth, the opportunity is there. And Levi gave you his contact information. Can you guys give contact information?
Sure. In My Healthe Vet, if you need to contact me directly, you can call 312-569-6450. Again, that's 312-569-6450.
My extension, 312-569-5533.
And that is it for us.
And you.
My contact information?
Sure. Yeah.
I don't know my phone number. But if you call the main number and ask for public affairs, you will get me. My name is